Mental health is something Canadians often take for granted, though mental illness affects most of us, directly or indirectly.
At some point in anybody's life, 1 in 5 people will be directly affected by mental illness.
Dr. Pratap Chokka is a clinical professor of psychiatry and practicing psychiatrist.
Anxiety seems to be the bane of our existence, and when we talk about anxiety disorders, we're talking about things like generalized anxiety, panic disorder, social phobia, but depression is right behind us.
And sometimes the reason they don't get treatment is because of stigma. They don't want to say it out loud because they're afraid of being judged, or they're afraid that they might lose a job.
Some have been like this since they were kids, but oftentimes a life stressor triggers on the first episode of a depression or anxiety.
So the Canadian Mental Health Association uses Mental Health Week to help bring attention to awareness and decreasing personal stigma or embarrassment surrounding mental illness. Effective treatment includes professional guidance.
For people that suffer from moderate to severe levels of mental illness, I think that medications are part of a whole army of treatments, including exercise, getting good sleep, nutrition, therapies.
When people don't get treatment or support at the time they need it, it just drags things out for them.
So the most common antidepressants, the ones that are out there, would be a class of drugs called the serotonin reuptake inhibitors. Those are the Prozacs, the Paxils, the Zolofts, the Effexors. For anxiety, those medications are also effective for anxiety as well, but there are medications like Ativan and clonazepam and so on.
But as they stress, treatment is far more than psychiatric pharmacy, with more focus on early diagnosis.
I find that the medications helps people somewhat, but it doesn't teach them skills or the tools to deal with some of these conditions that are lifelong.
Think about enjoying yourself, to think about relaxing, to think about getting enough sleep, to think about seeing your friends and family, to all of those components in our lives that sometimes we give short shrift to, but all together, when taken care of, promote positive mental health.
I think where we need to go is early diagnosis and early intervention. And I think we need to, in psychiatry, talk about prevention.
For more, go online to edmonton.cmha.ca. I'm Tim Dancy.